Good luck, Richard.
You ready, sir?
I'm ready.
Grey's Anatomy continues to blend emotional storytelling with real-life relevance in Season 22, Episode 8, Heavy on Me, a high-stakes installment directed by series star Kim Raver. Best known for playing Teddy Altman, Raver steps fully behind the camera this time, focusing on a deeply personal storyline centered on Richard Webber. The episode follows Richard as he grapples with a life-altering decision about his prostate cancer treatment. His journey mirrors actor James Pickens Jr.'s real-life experience, raising the emotional stakes for both the cast and crew. Raver has described feeling protective of the storyline, emphasizing accuracy, sensitivity, and respect in telling a story that resonates with so many viewers facing similar diagnoses. Guest star Jamie Lynn Sigler shines as Dr. Laura Kaplan, whose own health challenges help inspire Richard to confront his fears and choose surgery. Meanwhile, Bailey and Owen tackle a nearly impossible case involving a 35-pound abdominal tumor, ultimately saving a patient's life and reigniting Owen's passion for trauma medicine. Their teamwork highlights the show's long-running theme of innovation under pressure. The episode also continues Jo Wilson's postpartum recovery after her pregnancy-related heart condition, peripartum cardiomyopathy, drawing attention to a rare but serious medical issue that can be mistaken for normal pregnancy symptoms. Jo's advocacy helps save another new mother, reinforcing Grey's legacy of using medical drama to educate and empower viewers. With strong performances, real-world medical relevance, and confident direction from Kim Raver, Heavy on Me stands out as one of Season 22's most emotional and meaningful episodes, proof that Grey's Anatomy still knows how to hit hard when it matters most. Hey, lovely viewers, welcome to our channel Grey's Anatomy Official. Grey's Anatomy, Kim Raver previews, high stakes, and a personal episode about Richard. Grey's Anatomy has a well-established history of having its screen stars step behind the lens and take on directing duties, and this week, the tradition continues with Kim Raver helming Fortunate Son. Raver, who of course portrays Teddy Altman in the long-lived medical drama, directs the series' newest segment for the third time. "I'm just loving directing," Raver told TV Insider of the opportunity. She credits Debbie Allen, who's also a star and executive producer on the series, as a mentor, and also points to Kevin McKidd and Chandra Wilson as inspiration for her leap to behind-the-scenes action. Raver previously directed Season 19's Training Day and Season 21's Don't You Forget About Me, but unlike this week's edition, those two episodes involved her pulling double duty both off and on screen. The first one, I had such a big storyline as Teddy in front of the camera, and then also there were just so many events of the car crash and the brick coming through the glass. And I'm really happy, actually, that I started out also being in front of the camera, because I think when you have to juggle all the 20 different plates at one time, then it allowed me to go, oh, okay, I can totally do that, she told TV Insider. For the second, I also had that love scene that I was in with the amazing Sophia Bush. This week's episode, however, focuses on Richard Webber, James Pickens Jr., going under the knife as treatment for his prostate cancer diagnosis, as well as the arrival of Nick's, Scott Speedman, sister to his and Meredith's, Ellen Pompeo, house in Boston. This one, it's just visually different because I'm not imagining myself as Teddy in front of the camera. I'm just back at Video Village watching it all happening before me, she explained. The great thing is, I didn't have to memorize my lines. I could just show up as the director with that hat on. It's a good thing, too, that Raver's focus could be exclusively on the creative elements of the storytelling because the storyline is intensely personal for the Grey's family, considering Richard's prostate cancer journey echoes the real-life medical experience of the actor portraying him. The weight of getting that right was felt by all, Raver admitted. I have to say, Mr. Jim Pickens in this episode, I mean, as always, he's extraordinary, but he is absolutely incredible in this episode. It was such a pleasure to work so deeply with him, she said. I definitely felt very high stakes because I wanted to be able to be very mindful to tell the story in the most accurate and most sensitive way. Jim is the OG of the OGs, with Chandra Wilson, so they know the show so well. But yes, there's definitely a personal aspect of it, and he's just a real collaborator, but I definitely felt very protective of the storyline, especially. Raver teased that Pickens Jr.'s performance is extraordinary, as he shares the screen with guest star Dorian Harewood, who'd previously played another role in the Grey's spin-off Private Practice. I was just in awe, just sort of watching the monitors and watching them perform. It was a really special episode. The episode is written by Julie Wong, and Raver said she felt protective of the script story and bringing it to screen life because it also serves as moment of messaging about the very real-to-life healthcare journey that so many face. It's just such a special episode, Raver said. I felt very protective of it and just wanted to make sure that I got all the nuances and we were telling the story correctly, also to get the word out because I think that that's also really important. What a great opportunity that we have at Grey's to actually, hopefully, help people navigate something like this, which one of our actors had to actually do. So, yes, it was very personal. Grey's Anatomy highlights rare pregnancy-related heart condition, what to know. One mom who also went through peripartum cardiomyopathy opens up about her experience. Experts share what pregnant people should know. A recent storyline on Grey's Anatomy brought attention to peripartum cardiomyopathy, PPCM, a rare form of heart failure related to pregnancy. PPCM can look a lot like common pregnancy symptoms in the third trimester. Most people recover with early care, that's why it's important to advocate for yourself when you feel something isn't right, as one mom who went through it stresses. In a recent episode of Grey's Anatomy, Dr. Jo Wilson learned that what she thought were common symptoms of late pregnancy, especially with twins, including shortness of breath and fatigue, were actually signs that her heart was struggling to function. Her doctors soon learned that her heart muscle wasn't pumping effectively, a sign she was battling a rare but serious condition called peripartum cardiomyopathy. PPCM is a sudden weakness of the heart that develops around the time of delivery, related to the pregnancy itself, explains Lily M.D., a cardiologist and associate professor of medicine at Johns Hopkins University. It's triggered by the end of a pregnancy, she explains. While Jo's storyline might have been fiction, a Cincinnati, Ohio area mom named Casey Gould lived through an all-too-real experience with it, nearly losing her life when she went into cardiogenic shock following an emergency C-section. What it's like to experience peripartum cardiomyopathy. After 36 hours of labor, Gould was preparing to deliver her baby boy when she remembers, everything went black. There were shadows behind everything, and nobody else could see it, except for me, she recalls. I felt a really horrible sense of dread in my chest. I grabbed my doctor's arm just out of nowhere, and I said, I'm gonna die. This is it. I'm about to die. While there was no apparent reason for Gould to feel that way, her vitals were normal. It was at that same moment that her son's heart rate dropped enough for the medical team to rush her into an emergency C-section. Because her epidural wasn't strong enough, Gould had to be put under anesthesia, and her son, Archer, was born healthy. But when she was waking up in post-op, the then 33-year-old realized she couldn't breathe. Within a minute or two, they lost all my vitals, says Gould. I had no oxygen, no heart rate, no blood pressure. And they kept trying and couldn't get it. So, the ICU was called and cardiology was called, and then, I crashed. Gould's medical team at Atrium Medical Center in Warren County, Ohio, deduced that she had PPCM. My doctor had to decide whether I needed a heart transplant or if they could try the Impella, says Gould. They ultimately decided to at least try the Impella, which allowed my heart to rest. The major part of my recovery was having that. And then, they put me into a medically induced coma to allow my body to rest, and my heart could rest, and the Impella could do its work. 2 days later, Gould woke up, the Impella was removed, and her heart was able to take over. Following her near-death experience, Gould was left shocked and numb as she navigated life as a new mom who had just experienced cardiogenic shock. What are symptoms of PPCM? Peripartum cardiomyopathy is when the heart chambers enlarge and as a result, the heart muscle weakens, explains Randy Gould, a cardiologist with Manhattan Cardiology in New York City. What can make PPCM difficult to diagnose is that symptoms are also par for the course during the third trimester of pregnancy. Common symptoms are shortness of breath at low levels of exertion, swelling of the ankles and legs, fatigue, and palpitations, says Nika Goldberg, MD, a board-certified cardiologist in New York City. But many times, swelling at the end of pregnancy, or right after, is normal, especially if someone had a C-section, says Dr. Barouch, adding, and everyone in their last few weeks of pregnancy feels kind of short of breath, because the baby is squishing up your diaphragm. That said, you want to look out for swelling or shortness of breath that's glaringly out of proportion to what's normal in late pregnancy. Severe shortness of breath, like you can't even walk around the room, is not normal, says Dr. Barouch, who adds to also be on the lookout for shortness of breath when you're lying down on your side, or a cough, paired with shortness of breath, that begins when you're lying down. Swelling that keeps getting worse or sudden, and alarming weight gain are also red flags of PPCM, says Dr. Gould. Although she had an otherwise normal, healthy pregnancy, Gould recalls gaining 20 pounds in her last month, noting, "That can now be attributed to just pure swelling from my heart starting to fail." Dr. Barouch adds that palpitations or feeling like your heart's out of rhythm can also be common in pregnancy but might also be a sign to see your healthcare provider. What to do if you suspect you might have PPCM? Given how challenging it can be to differentiate the symptoms of PPCM from the typical side effects of being in your third trimester, both Gould and Dr. Barouch encourage expectant parents to advocate for themselves if they're experiencing any concerning symptoms. I would encourage women who are concerned to say, "I'm concerned that I might have PPCM because my symptoms seem worse than normal for me, or because they're becoming severe or getting worse rapidly," says Dr. Barouch. You can also ask if you are gaining weight at an appropriate rate or if you seem to be having an unusual amount of fluid retention. Then, in addition to a referral to a cardiologist, you might ask for a BNP, brain natriuretic peptide, blood test, a screening tool that can signal if heart failure is developing, as well as an echocardiogram, an ultrasound of the heart that can confirm diagnosis. Early diagnosis allows for prescription of medication, such as diuretics, to alleviate symptoms and beta blockers to relax the heart and help improve heart function, explains Dr. Goldberg. Most patients do see their heart function recover following a PPCM diagnosis. This is especially the case if it's treated early and aggressively with medications and mechanicals to support the person until the heart can start to recover, says Dr. Barouch. More than 50% of women's heart function will eventually return to normal. What life after PPCM looks like. Following her experience, Gould grappled with the emotional and mental toll of enduring a traumatic birth, something that affects 1 in 3 women. 3. I was dealing with not just the anxiety of bringing a baby home, but also the anxiety of having cardiac issues, which I didn't have before, she says, recalling that 2 or 3 months after giving birth, she started going to therapy, which she says was absolutely the right step. It was something that I really needed to do, because I blamed myself a lot for everything that went wrong, even though obviously it wasn't my fault, explains Gould. Although she and her husband had initially planned to have more children, Gould knows her life will be really full as a family of 3. I was told, with my situation, that I would die if I gave birth again, because subsequent pregnancies will only make it worse the next time, she explains. While the safest move is to avoid a future pregnancy, says Dr. Barouch, the decision to give birth again is a highly individualized one that PPCM patients generally work with their cardiologists to navigate. Telling her story and bringing awareness to PPCM has also proven therapeutic for Gould. What happened to me was so rare that most people don't need to be concerned with it, she notes. Yet, after her near-death experience, Gould believes it's crucial for parents to speak up for themselves. Dr. Barouch agrees, reminding people that there's no harm in going to bat for yourself. If something doesn't feel normal for you, you should speak up and not be afraid to mention a specific concern, like maybe it's PPCM, not just normal pregnancy symptoms, she says. It's never wrong to ask questions or ask for testing. If everything turns out to be normal, that's great. Your official Grey's Anatomy recap, Season 22, Episode 8. Last week's episode of Grey's Anatomy ended by assuring us all that Joe Wilson was going to be okay. We love a dramatic eye-opening from a hospital bed, but this week, she's still dealing with a complicated postpartum situation. She's not the only one facing some complex life moments, though. Heavy on Me sees Richard make a major decision about his prostate cancer treatment plan. Bailey and Owen team up to remove a 35-pound tumor from a woman's abdomen, and Jules ponders if she is too aloof. I guess that last thing isn't as dramatic as cancer treatment and giant tumors, but it is important nonetheless. Let's dig into this week's episode. Richard makes his choice. There's honestly nothing like one of our Grey Sloan docs emotionally declaring that they are a surgeon with verve and feeling, reminding us that's who they are in their bones. This is exactly what Richard Weber does by the end of Heavy on Me. Richard has been through so much, hasn't he? Remember when he had a brain tumor? Or when he got cobalt poisoning from a hip replacement? Or that time Meredith told him he's the reason her mom tried to kill herself and ruined their lives? So much. And now our chief of chiefs is left angsting over how he should treat his prostate cancer. Well, I guess it's more technically correct to say he's angsting over how Catherine thinks he should treat his prostate cancer. Richard's already made his decision with his doctor, they're going to wait and watch, he doesn't want any kind of risky surgery. What does Catherine want? Well, she's flown renowned urologist and urologic oncology superstar Dr. Laura Kaplan in from Boston to tell Richard to have the risky surgery. It is Catherine's way. Richard's initial meeting with Dr. Kaplan and Catherine ends with him storming out. Kaplan thinks he should do a radical prostatectomy and have the entire thing removed. Richard knows the risks of that surgery, and blood clots, stroke, and injury to the rectum are just 3 in a very long list. But when he runs into Kaplan doing work in the attendings lounge while she's waiting for Catherine's plane to take her back to Boston, Richard isn't angry with her. Both of them understand how Catherine works. Kaplan apologizes for not realizing Richard wasn't the one requesting a second opinion, and she also wonders if he could consult on a patient she's working on. It seems the two become fast friends. Eventually, Kaplan opens up to Richard about having multiple sclerosis. Getting that initial MS diagnosis was terrifying, she worried she wouldn't be able to operate anymore, and it was soul-crushing. But instead, she came to see her MS as not a career ender but as a career pivot. Her symptoms, like muscle pain and leg weakness, would make it nearly impossible for her to stand in and operate, so she simply found a different way to operate. Now, she mainly performs robotic procedures, she can sit, and she doesn't need to be able to hold a scalpel. I still get to do what I love, even if it is in a different way, she tells him. Her words cut to Richard's core. When he sees Kaplan leaving later, he tells her that he rejected her opinion out of fear. If he suffers complications from a radical prostatectomy, especially a rare but very scary-sounding urosymphyseal fistula, he too might never get to operate again. Kaplan reminds him that she can treat complications, but if the cancer progresses, Richard runs out of options. And that seals the deal. He finds Catherine to tell her he doesn't want to live in fear, and all this time, it was his fear that was making medical decisions for him. He's a surgeon, and he'd be devastated to lose that part of him, but whatever happens, people can adapt. He can adapt. He's getting the surgery. A little inspiration goes a long way. See? Sometimes a person simply needs a little push to do something scary but important. Sometimes a person simply needs a little inspiration. Inspiration, as it happens, is exactly what Owen is missing these days. After listening to Teddy and Winston talk about the innovative aorta surgery they pulled off with Nora on podcasts and the like, Owen is a tiny bit jealous. Teddy deserves all the press and accolades, of course, and he repeatedly wants to make sure everyone knows he's totally fine with all this, but more and more he's feeling like his own work is stalling. He's got a case of the bloss, okay? So, when Bailey and Simone present a patient with a 35-pound benign tumor compressing all the organs in her abdomen, Owen is the only doctor who backs them up. He thinks Bailey can remove this tumor, and he wants to help. It doesn't take long for Bailey to realize Owen's motivations for joining her team might not be totally altruistic, but they are mostly altruistic, and that's good enough. She needs as many brains on this case as possible. The patient, London, has attempted surgery before, but because of the pressure on her heart, she's wound up crashing on the table before doctors can remove even part of the tumor. It's Owen who brings up putting London on ECMO so that there would be no shot of her heart failing in surgery. Good for him. It's unconventional, and London's wife, Charlie, is hesitant, but London doesn't particularly feel like waiting around to suffocate to death. She wants to live. She wants the surgery. Bailey and Owen are joined by Winston, Simone, and Lucas in the OR, and while there is more than one moment when things look bleak for London, the team work flawlessly together and eventually remove that behemoth of a tumor. I hope Owen puts it in a jug and takes it home. London is saved, Bailey is relieved, and Owen is finally getting his medical mojo back. In fact, by the end of the episode, he asks Bailey what she would think about building some type of EMS training or ambulance ride-alongs for the residents so they can learn more about thinking on their feet and get additional trauma training. Bailey tells him to write up a proposal for her. Owen Hunt is inspired again. Meet Jules.
Um,
Sally. Definitely Sally. Like Owen, Jules Millen is in a bit of a slump. Hers, though, is not of the medical variety but rather stems from her non-existent social life. Jules has always been slow to let others in, a trait that sometimes has consequences like the one we saw her face last week when she dashed over to Joe's to tell Winston that she's interested in him, only to find him having drinks with Nurse Iris. It seems everyone around her is busy with other people they've let into their lives, and for Jules, well, the cheese stands alone. Lucas may not be dating Katie yet, but the two are texting regularly, and he does seem to perk up every time he hears from her. Naturally, this bugs Simone, who admonishes him for an inappropriate relationship with a patient, which is hilarious because she is currently and enthusiastically boinking an intern. Eventually, Simone realizes what Lucas is up to is none of her business, and the two manage to have a friendly conversation about getting Katie movie recs while she's laid up. Are these two healing? I will forever be holding out hope that they once again find their way to an on-call room, but for now, this is nice. Quan too seems to have mended whatever he may have messed up last week with Mohunty. Those two and their booty calls are going strong. Good for him. But Quan's not so swept up in his new situationship that he doesn't notice things are off with Jules. Remember when those two were in love with each other? It seems Quan is still a softie when it comes to Jules. Not only does he give up the race for a thrombectomy so that Jules has something to look forward to, but later he notices Jules staring longingly at Winston and realizes what her real problem is. It's Quan who tells her that Nurse Iris is merely a stop sign, not a roadblock, when it comes to her obvious feelings for Winston. He doesn't want her to give up. I do love when Quan is this sweet, but it is also deeply unsettling. Watching all her friends and her big-time crush enjoy their time with other people has Jules feeling down, and it certainly doesn't help when she once again gets saddled with a patient who comes in with some sort of relationship bent to their backstory. She always has to deal with the people who are incredibly in love. It's the universe just repeatedly hitting her over the head. When Jules meets Janet and her husband, Hal, who enjoy role-playing as doctor and patient, until Janet arrived at the hospital with a DVT and a need for an emergency thrombectomy. She's mostly confused about why they would need to pretend to be other people to be interested in the person they supposedly love. Jules is very judgy. But wouldn't you know it? At the end of a long day and another interaction with Winston in which they both clearly want to smash their faces into each other until Iris shows up, no shade, she seems nice, Jules is approached by a cute guy at Joe's, and instead of pushing him away, she invites him to sit down and introduces herself as Sally. Maybe role-playing to liven things up isn't so bad after all. On making mom friends. How about we end this recap with a quick check-in on our constantly beleaguered family of 6, the Lincoln Wilsons. Or the Wilson Lincolns. Have we landed on one of those yet? I am thrilled to tell you that Joe and Link have named their 2 new little ones, welcome to the world, Peyton and Hattie. Joe is on the mend, but it's been only 3 days since Winston had to adjust her pump lest she go into cardiac arrest, so while her heart is getting stronger, she's still being observed. The good news is she does get to spend time with her babies up in the NICU. The bad news is postpartum hormones are a bitch. Joe is crying all over the place, as is her right. After the things this woman has been through in this month alone, I'd be catatonic. Everything is turning Joe into a puddle, even a nice NICU mom named Gina, who refers to her as Peyton and Hattie's mom for the first time. The two women chat, Joe gives Gina some postpartum advice as a doctor, and Gina is thrilled to have her first real mom friend. It's very cute. And then Gina falls over and begins having a seizure on the NICU floor. Not so cute. Joe can't move out of her chair, but she flies into OB mode anyway. She can tell Gina is suffering from eclampsia, and if she can't follow her to the OB floor, she wants Link to be her proxy. From speakerphone, Joe demands that the intern put in charge of Gina's care administer magnesium to stop the symptoms. When he hesitates at her diagnosis of eclampsia, boy, does she ream that kid out. A glorious sight to see. Gina's going to be okay, thanks to Joe, who, yes, is still crying. She even takes Nurse Iris' head off when Iris refuses to violate HIPAA, and wishing she felt more like herself. She already misses not being able to be a real doctor at the moment. Sure, it's only temporary, and Joe will be back, but wow, is her maternity leave going to be a real doozy? Grey's Anatomy Season 22 airs new episode tonight, where to stream free. Bailey and Owen join forces to save a tumor patient in a new episode of Grey's Anatomy, airing on Thursday, January 15th. The new episode will air at 10 p.m. Eastern Time on ABC. Those without cable can watch the show for free through Fubo TV or DirecTV, each of which offers a free trial to new users. Sling is another option for streaming the show, and promotional offers are available. Watch Grey's Anatomy for free on DirecTV. The new season picks up after Season 21 ended in a catastrophic hospital explosion, leaving the Grey Sloan staff to save not only themselves but their patients, too. For those who don't know the series, Grey's Anatomy is a high-intensity medical drama that follows a team of doctors at Grey Sloan Memorial Hospital who are faced with life-or-death decisions daily. They seek comfort from one another, and, at times, more than just friendship. Together, they discover that neither medicine nor relationships can be defined in black and white. Ellen Pompeo returns as Meredith Grey, Chundra Wilson as Miranda Bailey, James Pickens Jr. as Richard Weber, Kevin McKidd as Owen Hunt, Kim Raver as Teddy Altman, Camilla Luddington as Joe Wilson, Katarina Scorsone as Amelia Shepard, Kelly McCreary as Maggie Pierce, Chris Carmack as Atticus, Link Lincoln, Jake Borelli as Levi Schmidt, Richard Flood as Cormac Hayes, and Anthony Hill as Winston Dugu. In the new episode, Bailey and Owen join forces to save a tumor patient. Richard faces an internal battle and Jules struggles with her feelings for Winston. Grey's Anatomy: A sneak peek. Jamie Lynn Sigler's Dr. Kaplan arrives and Richard is not happy. Thursday's episode of Grey's Anatomy introduces Jamie Lynn Sigler as a guest star. The Sopranos alum stars as Dr. Laura Kaplan, and in this exclusive sneak peek, she's introduced to Dr. Richard Weber for a very important reason, even if he doesn't like it. This week, another famous TV face is joining the gang at Grey Sloan Memorial Hospital. Jamie Lynn Sigler makes her series debut as Dr. Laura Kaplan, a urologic oncologist who's summoned to the hospital by Catherine Fox, Debbie Allen, to speak with her husband Richard Weber, James Pickens Jr. In this exclusive sneak peek at Thursday's, January 15th, new episode, Catherine, who is not known for singing praises without good reason, showers Dr. Kaplan with compliments. "You are at the forefront of urologic oncology," she says, earning a not-so-subtle eye roll from Richard. "And that lecture that you gave the American Urological Association last month brought the house down." And she is inventing a program that uses AI to study biomarkers. When Catherine then invites her to tell us about my husband's prostate, it's clear Richard wants her to do no such thing. "Catherine, please," he says, earning a look of incredulousness from Kaplan. We'll have to wait and see whether this is another moment of Richard being reluctant before finally giving in to her, or if he's going to stand his ground and refuse her help with treating his condition. In the fall finale, Richard revealed that he was diagnosed with prostate cancer, which was a reflection of Pickens Jr.'s real-life diagnosis with the same disease. Grey's is also expected to double down on that art-imitating life element. Sigler's character is expected to have multiple sclerosis, much like the actress has for years. We also learn in the clip that Kaplan is one of Fox's recruits who works at the Fox Foundation's Boston hospital after being poached from Sloan Kettering, which means she is officially part of Fox's regular circuit and may work with others in the Grey's family currently located in Boston, like Jackson Avery, Jesse Williams, and Meredith Grey, Ellen Pompeo. Thursday's episode, titled Heavy on Me, has the following official description: Bailey and Owen join forces to save a tumor patient, while Richard faces an internal battle. Meanwhile, Jules struggles with her feelings for Winston. Grey's Anatomy Season 22 Episode 8 Review, a mixed bag of plots. Is it just me, or has Grey's Anatomy been a mixed bag these days? The tone of these installments can be all over the place, resulting in some storylines working better than others in any given hour. For example, with Grey's Anatomy Season 22 Episode 8, Weber learning to navigate decisions regarding his prostate cancer and Bailey and Owen finding their own inspiration, resulting in them pulling off the impossible, were compelling. The rest? Not so much. Weber's journey is compelling. As long as Catherine takes a back seat. Catherine has become such a frustratingly one-dimensional character. We can always count on her to overstep boundaries, get bossy and pushy, and then ultimately end up asking for grace or forgiveness from Weber. It's rinse, wash, and repeat. But if she keeps doing the same things over and over again, when does she really learn? Of course, she took control over Weber's treatment plan as it related to his prostate cancer. Tonight on ABC, their hit drama Grey's Anatomy returns with an all-new Thursday, January 15, 2026, Season 22 Episode 8, and we have your Grey's Anatomy recap below. In tonight's Grey's Anatomy Season 22 Episode 8 called, Heavy on Me, as per the ABC synopsis, Bailey and Owen join forces to save a tumor patient, while Richard faces an internal battle. Meanwhile, Jules struggles with her feelings for Winston. We are so excited for another season of Grey's Anatomy, so make sure to bookmark this spot and come back from 10 p.m. to 11 p.m. Eastern Time for our Grey's Anatomy recap. While you wait for the recap, make sure to check out all our Grey's Anatomy recaps, spoilers, news and more, right here. Tonight's Grey's Anatomy recap begins now. Refresh page often to get the most current updates. In tonight's Grey's Anatomy episode, Teddy and Winston did a podcast about Nora's surgery. It was groundbreaking surgery. They might have saved thousands of lives by proving it could be done. It gave Owen hope. It did the same for Bailey. Bailey has a patient whose benign tumor could kill her simply because of its placement. It displaces the lungs as well as the heart. It was resistant to chemotherapy. She experienced 2 surgeries that had to be aborted at the last minute because she kept flatlining on the table. Bailey didn't care about all of that because she knew that a successful surgery could give this patient back some quality of life. Bailey wanted to push ahead with surgery. She went to the idea table amongst doctors. She asked if anyone could stand with her in doing the surgery, and most of them turned it down fast. They didn't want to risk a possible lawsuit. That's how they saw London. London was merely a lawsuit. She wasn't a person anymore to them. They didn't want to risk getting sued just to save her. Bailey was still pushing ahead, and Owen must have been a little too moved from earlier podcast because he agreed to do the surgery. There was just one problem. Neither he nor Bailey had an actual plan to tackle the many complications that would come with surgery. They were just willing to risk it because London doesn't have any other choice. They roped in Winston to see if he could help them. They had the interns doing background research into similar tumors. They wanted to know everything that's worked and not everything that failed. Lucas didn't mind working with Simone. Then again, he didn't know that she now officially sleeping with an intern. Simone was sleeping with Wes. They hooked up the first time and it stopped Simone getting back together with Lucas. Now, they were hooking up because Simone felt she didn't have enough problems. Her relationship with Lucas nearly destroyed her career. She's now getting involved in another workplace romance, and this time with someone junior to her. Simone knew she shouldn't. She also knew she shouldn't be jealous of Lucas's patient. The one that was messaging him all the time and asking for movie recommendations. Katie has stage 4 cancer. She was in a clinical trial that might not work out. She didn't have much. Let her have this friendship. Lucas thought he was just being supportive. It was Simone that claimed he could be leading her on by not defining boundaries. Like she could talk with what she has with Wes. Does Wes know it was only sex, or does he think they could be something more? It's the same problem that Quan had last week with the fellow that he's sleeping. They work together, and seeing each other every day might lead someone to believe they were dating. Those two decided that they were merely sleeping together. Simone's case might be something more, if not something with the potential of being different. Simone doesn't know. Lucas doesn't know about it. She therefore doesn't have a right to be jealous of getting friendly with another woman. The two didn't find a solution with similar tumors because there were no similar tumors. None that had the same markers as London's tumor. It's okay, though, because Owen finally came up with an idea. Owen realized they could use ECMO. The ECMO would be pumping the blood through her veins like her heart normally would. It would stabilize her in surgery long enough for them to get to the tumor. They agreed to it. They talked London about it. She agreed because she didn't want dying slowly. Her wife was apprehensive. She still agreed to it, seeing it as it was the only solution. London's surgery was tricky. She nearly coded on the table and they stopped it. They were able to successfully remove her tumor. Jo in the meantime got to spend with her girls in the NICU. She met another mom with a baby in there. They became mom friends. Unfortunately, this friend started to seize. She was suffering from preeclampsia. Jo recognized the signs. She talked the woman's doctor through what needed to be done. She tried to check her file later on and her favorite nurse refused to do it because Jo wasn't the doctor listed on the file and so Jo lost it. She began yelling. Her husband had to roll her wheelchair away. Jo has been through a lot and it was all catching up to her now. Jo has been quite emotional since the twins' birth. She even cried when she found out Iris has been grabbing drinks with Winston because Iris was her favorite nurse. It's why she was going to apologize to her after today. She also considered changing hospitals. She was embarrassed she cried so much and in front of so many people. Mind you, the Iris thing had Jules avoiding Winston until she could no longer do so. She helped a couple that needed help and that gave her the push she needed to be adventurous. Richard also agreed to seek other options for his prostate cancer. His wife wanted him to. He kept refusing to do earlier because he didn't want to take opioids for the possible pain and that's just a risk he has to take if he wants to survive this thing. Grey's Anatomy, a season 22 episode 8, how to watch for free when is Grey's Anatomy in 2025 on. Grey's Anatomy continues on Thursday, January 15th at 10 p.m. on ABC, and will likely conclude around 11 p.m. It will be followed by local programming thereafter. How to watch a Grey's Anatomy online on demand. If you want to record Grey's Anatomy, or want to watch other ABC content online as it becomes available, check out DirecTV, free trial, or Fubo TV. Jo is finally recovering and gets to meet her twins on Grey's Anatomy Season 22 Episode 8, Heavy on Me. In the promo video for the episode, we learn it's been 7 days since her surgery, and she has had the chance to meet them, though it's clear both babies will probably be in the NICU for a while. Your official Grey's Anatomy recap, Season 22, Episode 7. Let's calm everyone's hiatus fears. At the top of the Grey's Anatomy mid-season premiere, Winston Dugu successfully performs a C-section on Jo Wilson and delivers her and Link's twin girls. Baby B gets an assist from an OB who finally freaking shows up. That's good news, right? Yes, definitely. But as Grey's is wont to do, troubling news immediately follows. Jo's heart is still failing. Winston is able to place the pump to, hopefully, correct her cardiomyopathy, but she's still in critical condition and comes out of that, or as a mom to twins, but also in a coma. On top of the very precarious Jo and Link situation, Skyfall also has some fallout from Richard Webber's cancer, 2 residents making some major romantic decisions, and a patient literally falling out of the sky. Welcome back to Grey Sloan Memorial, everybody. Checking in with the Lincoln Wilson family. So, yes, Jo is in a coma, and her heart is not healing from the pump placement as they'd hoped. It's bad. And yes, both of her daughters are on vents in the NICU, and while baby A is quickly moved to a CPAP, they discover that baby B has a heart murmur. Again, very bad. Oh, did you think I was going to have a third thing here that offered some sign of hope? Well, you're wrong. Everything is bad right now. Poor Lincoln is barely holding it together as he runs from his intubated wife's hospital room to the NICU to be with his daughters, and on top of that, he needs to keep checking in on his other 2 very small children. Link is so stressed and upset, understandably, that he doesn't notice just how many people at that hospital are rallying around him. Ben, Bailey, and Webber refuse to leave Jo by herself. Teddy arrives to be there for Link and for his daughters, offering to help him parse through baby B's heart issues. In fact, at one point, when Link returns to the NICU, it's Teddy who has to warn him that baby B was sedated and put on an oscillatory vent because of her heart issues, which means it's Teddy who takes the brunt of Link's anger for not informing him that this was happening. It happened fast, there was no time to wait. Teddy, of course, doesn't take it personally. Link is hurting, and now, on top of everything else, he feels guilty for not being there for his daughter. It's Webber who finds Link alone in the chapel. Link is not a religious person, and praying really only makes him angrier. He doesn't even know why he came into this room even though we all know it does seem to beckon the sad men of Grey's Anatomy from time to time. Webber tells him that it's okay to not find peace or comfort in the thought of a higher power. In AA, he says, they have a saying, if you can't bring yourself to believe in a higher power, believe in the people in this room. Link has a room full of some pretty great people. Let them give you peace, Weber tells him. 22 seasons in, and Richard Weber is still out here releasing bangers. Link finally sees all the support he has. He apologizes to Teddy. He asks Ben for help when he needs it. And in the end, he finally gets some good news. Both Baby B and Joe show signs of healing. The baby by finally peeing, get it, girl. Before the episode is done, Joe opens her eyes. Hey, so maybe this storyline does get to end on a comforting bit of hope. Is the pact intact? Over on the romantic side of Grey's Anatomy this week, our residents are learning one of the lessons best taught by the death-ridden hellscape that Grey Sloane so often becomes, just go for it, ya dummies. At the beginning of the season, Jules and Simone made a celibacy pact. They are serious women who are serious about their work and seriously have zero time for sex and the inevitable drama it brings. This pact, of course, was just a vehicle for both women to live in denial a little longer in regard to the fact that they both had caught some feelings for men who would make their lives complicated. Jules and her mentor Winston have been slow-burning their romance since last season, and Simone can't seem to stay out of Wes, her hookup who was the nail in the coffin of her relationship with Lucas. That man is so tall, and he is seemingly everywhere. It has become very obvious that their heads may be in the pact, but their hearts, and libidos, are definitely not. When an emergency rolls in and Jules learns that the victim, Graham, who is suffering from severe burns and internal bleeding, was attempting a skywriting proposal for his girlfriend of just 8 weeks, she couldn't roll her eyes harder. This guy, a rope course instructor who has had his pilot's license for just 4 months, is ridiculous, and there's no way his very put-together lawyer girlfriend Fiona would ever say yes. And then, Jules meets Fiona. Fiona is deeply in love with Graham. She is beside herself that he got hurt trying to propose. She didn't need some big gesture, she would have said yes. She explains to Jules that most people don't understand their relationship, but that doesn't matter, it makes perfect sense to her. And when Graham ultimately succumbs to his injuries, Jules watches as a devastated Fiona collects her dead boyfriend's things. The tragedy inspires Jules, who cares if being with her attending mentor will make things complicated or if people might judge her. Jules has feelings for Winston, and she needs to act on them before it's too late. She rushes over to Joe's, where she is about to unload her feelings to Winston, but finds him happily sitting at the bar getting a drink with a very cute OB nurse named Iris. Jules isn't falling to her death from a prop plane or anything, but she may have very well missed her chance with Winston. Simone also finds herself inspired to take action that day, and it comes from a surprising source, Benson Quan. I mean, this man seems to have terrible decision-making skills when it comes to women, but Simone has honestly been desperate to find any reason to finally revisit her time well spent with Wes. Quan and Mohunty apparently had a very satisfying evening together following their elevator makeout. A woman doesn't make waffles for mediocre sex, okay? Quan insists to Simone that he and Mohunty aren't serious, this is supposed to be fun. But Simone, hung up on how things fell apart for her and Lucas, advises her roommate that workplace relationships can't just be fun. When you sleep with someone you work with every day, there is no way it can't be serious. He needs to make some sort of gesture to show Mohunty he understands this rule. Simone is nearby when Mohunty gets the flowers, so she has a front row seat to Mohunty's confused reaction. Mohunty thought she and Quan were on the same page, that this was just supposed to be fun. Simone completely read Quan's situation wrong. Quan and Mohunty seem to be just fine after an awkward conversation that only serves to endear the resident to our new plastics fellow. They will continue having unserious fun for the foreseeable future. Simone, however, has her world rocked a little. Maybe a workplace relationship can be fun? Maybe she doesn't have to take her attraction to Wes so seriously? The next time she sees him, she pulls him into an on-call room and finally gives in to her feelings. Something tells me this thing with Wes won't remain carefree for long, but for now, Simone is finally going for it. That pact? That pact is so not intact anymore. Grey Sloane Memorial, where the doctors get involved. The doctors at Grey Sloane just love to get emotionally attached to their patients, don't they? Many times, this is because they already happen to know their patients, as with Miranda Bailey's problem this week. Weber isn't her patient, exactly, but she is the only one who knows about his pancreatic cancer diagnosis, and that puts a lot of pressure on her to make sure he's not living in denial. He doesn't even know what stage his cancer is, and he needs more blood tests, but he's been slow to do anything about it. She thinks he's stubborn, and he thinks she's butting in where she doesn't belong. But Bailey isn't one to give up, and Weber just shared that very heartfelt moment with Link about letting the people who love you give you support, and in the end, he has Bailey take blood for him so he can get additional tests. He's hearing what she's saying. While that relieves some of the stress Bailey's feeling, she's also worried about Joe. It certainly doesn't help that in the middle of everything, she is the one in the room when Joe goes into VTach. Ben and Winston eventually arrive, and Winston simply needs to adjust Joe's pump, but it's a scary moment, and Ben can see that Bailey is about to lose it. Once Joe is on the mend, he tells Winston he can take over, and Winston, good on him, can pick up that these two need some time alone. Bailey's having a panic attack, and Ben can see it in her eyes. He holds her hands as he has her name sounds she can hear. When that's not enough to ground her, he holds her close and talks her through it until she can breathe again. When Joe finally wakes up, I hope Bailey was the first person Link calls. The woman deserves to know. While Bailey's at Gray Sloan stressing over patients she already cares about, Lucas Adams is possibly getting involved in the traditional Grey's Anatomy "I'm getting too involved with my patient, and feelings are getting blurry" storyline. Bailey's stage for cancer patient Katie is set to begin her clinical trial, until Lucas, who you will remember asked Bailey to stay on Katie's care team throughout her entire treatment, discovers her first dose of medication is expired. Bailey, clearly stressed enough, wants Lucas to handle the problem. This means it is Lucas who drives Katie over to a hospital in Tacoma where they have the same drugs available. Thanks for watching this videos. Please hit the subscribe button and give this video a thumbs up.